just stick to the basics around the navigator.
Okay.
Yeah.
Just a couple of minutes. How are you? Well, good afternoon. I'm Kathy Castor, U.S. Representative, representing the Tampa Bay area. I'm here with Jody Ray from USF's Florida Covering Kids and Families. And today we're here to talk about the good news. According to the report announced by HHS this morning, Florida families are going to have affordable health insurance rates. We've been waiting for this news for many months. And the good news is that the new healthcare marketplaces that will launch next week will have a great variety of options for families and individuals across our community, and they will be affordable options. Depending upon your situation, you can pick a bronze, silver, or gold plan, select your benefits, what you want, a higher deductible or a lower deductible. But this is very meaningful, especially in Florida, where 25% of our population do not have health insurance now, which means people who have insurance oftentimes pick up the extra. The costs are shifted to them. So for families who do not have insurance, this is great news, affordable options and many options. And then if you have insurance, you're going to be in better shape because your neighbors are going to be covered and the costs will not be shifted to you. HHS has reported that some of the rates will be around $100. I mean, that makes it very affordable for the young person who's out there working. I know President Obama said yesterday that some of these monthly health insurance rates are going to be lower than cell phone bills for many young people. So I think this is going to turn out to be quite attractive for families and individuals all across the Tampa Bay area. Affordable health insurance rates that roll out next week, and then sorting through the options is going to be challenging, I think. So that's why I asked Jody Ray to join us today. Jody is one of Florida's navigators. The University of South Florida won the largest grant in the state to help people sort through all of those options on the health insurance exchanges. So Jody, thank you for what you're doing. I know you're getting ready for the marketplaces to launch next week. Tell us how people get a hold of you if they need that information on sorting through all of the options.
So what we're really focused on is making sure that all these navigators are hired and in place. Considering we're looking at a large part of the state under our grant, we've got quite a large number of navigators that are getting hired. They're completing the 20 hours of training and certification through HHS. And once they comply with their licensing requirements for the state, they'll be able to assist families starting October 1st. So we already have been taking appointments for October 1st, and HHS or healthcare.gov is posting where people can get information local to them to find out where somebody is that can provide the assistance they need. So these navigators and their contact information and the kind of assistance that they can provide will be available on the website for consumers, starting next week. So they can go on there now and start setting up their accounts and start getting some information to get ready to apply. And that's what we're encouraging families and individuals to do now.
That's terrific. So again, the good news is that HHS announced this morning that health insurance rates are going to be very affordable. They've come in now lower than expected. And even many of the plans lower than the national average here in Florida, even though the governor and the legislature took away the insurance commissioner's ability to negotiate rates. So that's why it was a big question where Florida's rates would land. So they're going to be affordable. We're going to have many options. What the navigators and Jody and all of her folks will be doing just kicks off October 1st. And then our neighbors are going to have months to review the options. It's not like you have to sign up on day one. You really want to sign up before the end of the year. And then when you add in the tax credits that are available, these health insurance rates are going to be even more affordable. So that's the good news for Florida families, especially here in the Tampa Bay area where we have a very competitive marketplace.
What's going to be happening with the fact that the governor and the legislature are not allowing the navigators to be in Lake County?
Well, our navigators are going to be in a variety of locations, and we're really focused on getting the navigators in places where they are specific to the populations that they need to serve. So we have a real diversity in terms of how we pull together our navigator initiative. And so we're going to have people in, in Hispanic health initiatives and, in places where they're dealing with people who have various disabilities and speak other languages. So our focus has been focused on getting navigators into places where we know they're going to have the contact and the reach for the populations we need to get to in a state that is as demographically and geographically diverse as Florida.
Well, but certainly places like free clinics, for example, are kind of a hub for exactly the type of people that you're going to be reaching out to. Isn't that sort of a hit that
So our plan allows us to really get to a lot of these folks. And in addition, a lot of these partners are going to be able to direct families to the navigators that are in those communities. So everyone is going to be in a position to provide the information of where navigators are, and everyone can participate in that. And I don't think there's anything that disallows anyone from directing individuals who need the assistance and connecting them to the appropriate navigators in those communities.
It was kind of an absurd move by the governor to say that people that want to get to a doctor or see a nurse in an affordable way will not be, these navigators won't have access to folks in our public health centers. But that's an exception. The community health centers across the state are going to be very active in enrollment. Many of the hospitals, like those in Baycare, Tampa General, St. Joseph's, all across this community are going to be very active in helping folks enroll. And then you've got to go into the non-traditional places. Our partners, nurses, churches, American Cancer Society, the AARP, all of these organizations are going to participate in a very robust outreach effort, not to mention the health insurance companies that are about to launch a very extensive PR campaign to try to entice them to sign up for Florida Blue or Humana or whatever option you watch. They're going to be quite active in their marketing and PR efforts too. So it's too bad that some Republican politicians have tried to sabotage and obstruct enrollment, but there's nothing like having affordable health insurance rates, great tax credits that come along with it that will entice people to sign up.
I'm going to ask you specifically about some of the pricing. We found that there appears to be a gap where some people make too little money to qualify for a subsidy. What's going on with that?
Well, that goes right to the heart of Florida. Will Rutherford, the Speaker of the House, and Governor Scott, not